So the first question there, a 67-year-old man with long-standing hypertension, hyperlipidemia, develops sudden onset of chest pain radiating to the left arm. So history of coronary artery disease, so he has hypertension, hypertension and hyperlipidemia, and now he's having sudden chest pain radiating to the left shoulder. So that's concerning for cardiac ischemia, right? EKG shows ST elevation in the anterior lead, right? So if you see ST elevation in the anterior lead, you worry about what? LAD occlusion. Which of the following best describe this type of necrosis that will occur in this affected tissue? So based on our explanation, the best answer there will be what? Coagulative necrosis. And if it's supposed to be in the brain, then it's going to be liquefactive necrosis. Very good. Next question. A 32-year-old man develops severe left leg swelling and cyanosis. Ultrasound reveals extensive iliofemoral deep vein thrombosis. So that's a big cut there, guys. And it progresses to tissue ischemia of the leg. What mechanism explains the ischemia in these conditions? What we said? Very good. Venous occlusion causing impaired arterial inflow. Check it out. Next question. A patient with atrial fibrillation abruptly develops severe left flank pain. So what's the relationship between atrial fibrillation and left flank pain? As you know, with atrial fibrillation, right, these patients have high risk for forming thrombus in the left atrium, right? So in the left atrium, they could form blood clots there, right? Because of the stasis of blood. And those blood clots could move from the left atrium into the left ventricle, and from the left ventricle, they could move into the systemic circulation. And depending on which direction they go, if they go up, they're going to go to the brain, and they could cause what? Stroke. And if they come down, they could go to the spleen, causing infarction. They could go to the intestine, causing infarction. They could go to the kidney. They could even go to the lower extremity, to the leg, thereby causing ischemia and infarction. So the CT scan reveals a wedge-shaped area of necrosis in the left kidney. Which of the following underlying features of the kidney explain why this infarct is pale? Remember, we said it's because of what? Very good. End artery circulation. And the last question, a 70-year-old man undergoes coronary angioplasty for occluded LAD. Several hours later, so hours later after we have done the coronary angioplasty, so meaning that we have opened up the obstruction, he later developed arrhythmia and a worsening chest pain, right? So somebody that already undergo corona, who had the occluded LAD, we've opened up the obstruction, but now this patient start having arrhythmia and worsening chest pain. And it will check some cardiac biomarker, example like troponin, right? Our CKMB, right? And they will realize that this enzyme, they are on the rise, even higher than when the patient first came in. So which of the following best explains the tissue damage occurring after reperfusion? So this patient probably undergoing reperfusion injury. After you open up the blood clot, after you relieve the obstruction, then the xanthine oxide start producing a lot of superoxide free radicals from the oxygen that's coming in. And so the best answer here will be very good. Free radical mediated cell membrane damage. Don't forget to watch that video on free radical. You're going to understand all these grammars that I'm speaking. We've come to the end of today's lecture, guys. Please don't forget to subscribe, share this video, like this video, and I will see you in the next lecture. Bye for now.